My name is Dr. Jay Vyas. I kind of have been all over the map. I grew up in Mississippi and Arkansas, and then I went to Baylor for undergrad. I ended up back at Arkansas for medical school, trained in Cleveland, Ohio, and the University of Iowa for fellowship, and then just kind of fell in love with Central Texas during my time at Baylor, and subsequently kind of ended up back in the Dallas-Fort Worth Metroplex, as I've got lots of family here. So got an opportunity to kind of travel throughout the Midwest and been in the Southeast, Southwest, and I've definitely kind of found my niche and have set my roots here now. Yeah, Interventional Pain and Spine is a practice that I founded in 2020 during the pandemic. Our goal is to identify the underlying problem that patients typically have, whether it's anything from headaches, neck pain, down to low back pain, sciatica. And identifying the underlying problem will allow me to come up with a good treatment plan to help you not only get out of pain, but hopefully get you back to functioning. My goal is to introduce different modalities of treatment, not just medication management, but some sort of procedure or intervention to help decrease the pain, in addition to getting you into therapy, and hopefully, fixing the underlying problem will help you get back to where you would like to be. So it's a multimodal treatment plan or a balanced approach, to treating whether it's acute pain or chronic pain issues. That's always been a strong passion of mine. When I was doing residency at Case Western in Cleveland, I had a attending physician there who had patients coming from all over Ohio that knew about my attending physician, and it really did inspire me. I saw the type of care that he provided and the type of treatment that he was giving patients who had been hopeless for several years due to their chronic pain or acute pain issues. And when I saw that, I knew from that moment that I wanted to have the same sort of impact on my patients' lives. And so out of fellowship, I worked for another group and saw that it ran more like a corporate business than a more of a patient-centric feeling. And so I ultimately chose to start Interventional Pain and Spine to do what I enjoy doing, which is treating patients without being compressed for time restraints or feeling that I have to do certain things in order to make ends meet, so to speak. So that was my purpose for being the founder of Interventional Pain and Spine, was to give patients the time and the type of treatment that they ultimately deserve. Yeah, the mission at the onset was to find those patients who either don't want to have anything major done in terms of surgery, or are not candidates for surgery because of other underlying health problems or conditions, and to try to offer them some sort of non-surgical pain relief. And that's always been my focus, is to try to get patients to having a quality of life that they are looking for and that they deserve, without having to have more invasive things done. That's always been my goal, and that still is my goal, is to provide options for patients, and whatever ultimately patients decide to do, I'm on board with. And I haven't deviated from that. My goal is always to educate and provide options for patients and see what we can do to try to get them out of pain. So some of the most common problems that we see in our practice are anything from headache symptoms coming from the neck, to arthritis in the spine, to acute disc herniations, joint problems or arthritis in the major joints, to neuropathy. Those are the most common things we see neck and low back arthritis is very prevalent. In fact, most people miss 80% of the US population will miss some time from work due to low back pain. And so when we see these patients, we try to obtain imaging, whether it's x-ray or a CAT scan or an MRI, to help identify what the underlying issue is. And then we come up with that treatment plan to help, mitigate that pain or get them relief that they're looking for so that they can get back to work or get back to playing golf or get back to life in general. How does it help the community? So a lot of people don't know that there are non-surgical options for treating back and neck pain or major joint pain. And I think by allowing patients to explore those options, it helps ease their minds, helps them get some sort of comfort knowing that, hey, I don't have to have some sort of major operation to get a quality of life back. And that's ultimately how we're able to help provide, good outcomes for people in the community. Anytime anyone hears pain management, there's a negative connotation with it. Everyone seems to think, oh, pain management equals pain medications. And I have a lot of people that, are actually quite surprised for the right reasons when they come in and they think, oh my goodness, I didn't realize there was so much that pain management had to offer. Because of the opioid epidemic, before the pandemic, there was this huge opioid epidemic that we all know about. And so people, anytime they heard pain management, people automatically felt that, we were, quote unquote, licensed drug dealers. And there's so much more to it. And I think when patients come in and talk to me and kind of see what some of those options are, it really does change their perspective. And they're able to see that, hey, if they're on medications, we can quickly reduce the amount of medications that they're taking with different modalities, including therapy and interventions, or we can get them off altogether. And that's always my goal. My goal is always to try to get people off of medications when and if possible, or at least reduce the amount of medications that you need, whether it's muscle relaxants, anti-inflammatories, or nerve pain medications. I think that was one of the most common misconceptions I heard even when I first started practicing was, hey, pain management, you guys typically just give out pain medications, and that's not the case. Top 3 recommendations, no bias, come see us. Obviously, look for someone that's going to be a good fit for you and for your needs. Try to find someone that, obviously is willing to work with you and help find the underlying etiology for your pain. And, someone that introduces, other modalities of treatment, including physical therapy, including interventions. And ultimately, the studies all show that those are the best ways to improve long-term outcome success. So like I said, my goal and my recommendations are to help mitigate the use of chronic medications, improve functionality, and help patients ultimately get that functionality back and quality of life. You can obviously visit our website. It's www.ipsdfw.net. And it's got a lot of good, helpful information on there, talking about some of the most common diagnoses that we see and some of the treatment plans that we offer. You can also visit our Facebook page. It's Interventional Pain and Spine. And if you type that into the search bar, our Facebook page will come up. And then certainly you can, kind of Google us too and kind of see some of our reviews.